So how are you, Sophie?
Yeah, I'm alright.
Well, Catherine's asked me to come to do this mid-module review because there's a few issues that are already raising a few concerns. How would you see that the placement's been going so far?
Yeah, they've been fine. I mean, I've passed them, so...
What about this placement?
Yeah, it's been alright. I mean, you get some people you get along with, others you don't, so...
I think the key things that Catherine's brought to my attention is lateness, so we need to talk about that. Issues in relation to professional conduct about not wearing your uniform correctly, and also some issues in practice about not really engaging, not communicating when you're in the clinical environment. So let's sort of think about the lateness. What's sort of going on? Why are you not coming on duty on time?
I thought I've only ever been like 5 minutes late. It's not been like really late or anything like that, so I didn't think that was too much of an issue. But it's more getting here, and sometimes my alarm won't go off. Or
What are you coming on public transport? So does that transport correspond with the shift starting times?
Well, it just depends on traffic, so I can't really predict whether they're going to be on time or not.
Can you turn your phone off and put it away in your bag, please? Thank you, because I want you to concentrate, and you shouldn't have your phone on with you really when you're on duty.
Okay.
One of the other girls comes on public transport as well, and she manages to get here about 15 minutes early, and I think that she is able to use public transport and actually get here on time.
Maybe you need to get the earlier bus so that you allow enough time. The issue about arriving on duty on time is that you're obviously coming to have a handover to know what has actually been happening with the previous shift. You've got colleagues who are waiting to go home, and if they're waiting for a member of staff, that is all going to be delayed. But actually arriving on time, ready to start work, is extremely important within this environment. So that will be something certainly that needs to be worked on. Now, Catherine also says about your uniform. Now, I can see today you're not wearing uniform correctly. Now, why do you think within the clinical environment we need to wear uniform properly?
Well, I get all the rules and why you can't and stuff, but I mean, I went out last night, I got up late this morning, so sometimes I just can't keep up with it, and I didn't realise I had to be it was really strict today, especially, so.
Well, the policy is very clear about what's expected, and certainly it's an infection control risk, having nail varnish on. There's also personal safety issues about wearing jewellery and making sure that your hair is tied up, etc. So that really does need to be addressed very quickly, because it is very important. And I'm afraid the fact that you went to bed late and didn't have time is not an excuse, because you need to be here on duty, on time, and be ready to obviously be fit to be in practice. The other issue is about engagement in practice, and Catherine's been telling me about how sometimes within a clinic situation you're holding yourself back, you're not engaging about what's going on, not communicating with the mentor. I think you've worked with other mentors, they've sort of said something similar.
Okay.
Anything you want to say about that?
I mean, I haven't been asking questions because I pretty much know, and I don't think of the questions, so I just figure them out, that sort of thing. And I thought I'd been okay, so.
One of the problems that we've had is I've not managed to see her OAR. She's never had it available for me to look at.
Right, okay. Have you got your OAR with you?
I'll double check. Yeah, I've got it.
Okay. Now, this is really important because this actually is meant to be a tool that can be used with the different mentors. And I know there were a few issues, weren't there, last time?
Yeah, I mean, I passed it, so...
Okay, but there were a few things that your previous mentor really wanted you to concentrate on for this placement,
Okay.
and I believe that timekeeping was one of them.
Right.
So it's very important that that actually is looked at the beginning of a placement to see where you need to. It's not to pass on how a student's doing so that they are labelled in any way. It's meant to be a very useful tool. So it's your responsibility to make sure your new mentor has this OER to read and look at
Okay.
the beginning of the placement. And if there has been some genuine things, I think you said earlier about perhaps not getting on with people, that's your opportunity to talk it through, because it could have been just a slight clash of personalities or whatever.
Okay.
But certainly there was a comment last time about lateness. Again, not every day, but there was a comment on lateness. So we've got a little bit of a recurring theme. There was also a comment here about uniform, not always worn properly. And I think there also was an issue about trying to concentrate, particularly on communication.
Okay.
Is there anything you would want to say in response to that? Is there anything that's going on? I mean, you know, how are things in halls and friends and whatever?
I mean, everyone that I live with go out every single night. And so either I miss out or I get woken up when they're coming back in.
Okay.
And, you know, I'm here for the uni life as well as learning to be a midwife, so...
Well, it doesn't mean to say you can't have a social life, but we need to know you're fit to come on duty.
Okay.
Because otherwise it is going to affect your placement, it's going to affect potential relationship with your mentors, and most importantly, potentially the care you're giving to women. Where do you plan to live when you move in a few months' time? Have you thought that
I
through?
was going to live with my friends.
Okay, are they midwifery nurse or nursing friends? Well, I mean, it is something to think about, that either students do have to negotiate within the flat about the importance of you not being disturbed, particularly if you're on an early the next day and they're perhaps coming in. Or a lot of midwifery students often will share with the other nursing and midwifery students because they find there's a lot better understanding about that. But it doesn't mean at all that you can't go out, but it does have to be around your programme, because you have got your clinical practice that you must be doing and succeeding in, as well as your university work.
Okay.
Do you really want to be a midwife, Sophie?
Yeah.
Okay. What I suggest we do then, we're going to write an action plan, and within this placement time that's left, you need to actually achieve the action plan.
Right.
Otherwise, I would not be able to pass you in this placement. Now, the biggest thing that I think you need to have is a little bit more motivation towards midwifery, a bit more passion and a bit more drive. And now you're going to get that by getting a little bit more understanding of the theory. So you will need to do some more reading at home.
Okay.
And actually then applying that and coming in with an enthusiasm to actually communicate with the women and actually participate in their care.
Okay.
Right, so that's one thing. I want some background reading, I want more motivation. I also need you to be on time, and I need you to almost plan to be early. And then if you plan to be early, then you know you're always going to be ready to start your shift.
Okay.
Okay, and lastly, I need you to think about your appearance. Professional conduct is a very important part of passing your course, and that part of it, if you fail, will be an automatic fail for the whole course. So you need to think about your hair, you need to think about your nails, your jewellery, and your overall professional appearance.
Okay.
And if you can do all of that, as we go along, I'm going to help you, but if we can do all of that, then you will pass the placement. But if you don't achieve it, then I have to tell you that there's a chance you could fail. Okay.
Anything you wanted to say in response at this point? Anything else we can perhaps help you with?
I don't really know, to be honest. Can I let you know if I think of anything?
So maybe perhaps we will have another meeting, Sophie, outside this meeting.
Okay.
And maybe talk a few of some of these issues further. Okay.
Okay.